developmental disorder. Okay. And we need and I said we more fra five between the poverty, the federal poverty level. One of them has some type of mental, behavioral, and I said developmental disorders. And we also see a correlation from age and poverty. So age and poverty level affected the likelihood of children receiving treatment for anxiety, depression, or behavioral problems. So in other words, poverty level, one's poverty level, was linked to whether or not they were able to receive proper treatment or not. Okay. Now we're gonna jump into anxiety. If I say anxiety, Mema Eunice Aka, what anxiety is, how do you even identify anxiety? What are some of the symptoms, some of the signs clear, and I say a warhol for people who are going through this specific type of condition. And then I'll talk a little bit about depression.
Okay. Thank you so much. And thank you for sharing that story. I think it helps us give us an idea of the extreme scenarios. And you described it, and I'm glad that you emphasized that it is not just those extreme scenarios that we can associate with mental health problems. Unfortunately, many of us, right, experience mental health issues, and anxiety is definitely one of them. So just to give us some clarity on what anxiety is, excessive worry and thinking about, or excessive worry and nervousness, right? And so if you're somebody who are constantly worried about the future, what's going to happen tomorrow, what has happened in the past, anxiety could be something that you may deal with, right? So when we think of children that deal with anxiety, there's different forms. Being very afraid when you're away from your parents. So if a child is away from their parents, let's say age 5, they're starting kindergarten, if I'm not mistaken, and they are going to be naturally nervous to be away from their parents because they spend about 4 to 5 years at home if they've never went to daycare. Right. But if you notice that the child does not want to stay at school, does not want to hang out with anyone at school, separating themselves from everyone, crying constantly, wants to be at home, and you notice that this behavior is going on for, let's say, weeks on end, then there might be some signs of separation anxiety. So that is one form of anxiety that a lot of children face. Having extreme fear about a specific thing or situation, like dogs, insects, or going to the doctor, for example, those specific anxieties are associated with phobias, right? So we'll be at, let's say, snakes, for example. For me, I don't think I can ever see a snake near me at any point. However, if you're someone who gets extremely nervous around a specific thing like snakes or insects or dogs or things of that nature, you may have a phobia of this specific item, which is also an anxiety disorder. Another one is being very afraid of school and other places where there are people. Going to church is an issue for you. You don't want to be in a social setting. You don't want to be at school. You don't want to be in the mall. This is something we refer to as social anxiety. All right. The main one that most of us give the diagnosis, if I have a client that comes in that says, I'm kind of worried all the time about everything, general things, right? This diagnosis we will give to someone is referred to as generalized anxiety disorders. And if you're someone who enjoys reading and wants to do more research, there's something we call DSM-5, the Diagnostic Manual for Psychiatric Disorders. And you can see all of these diagnoses there. But the main diagnosis we will give to someone is generalized anxiety disorder if you're someone who is constantly nervous about the future and general things. One of the other disorders is having repeated episodes of sudden, unexpected, intense fear that comes with symptoms like heart pounding, having trouble breathing, or feeling dizzy, shaky, and sweaty. So this is what we associate with panic disorder. So let's say you are driving in your car, you're feeling very nervous about where you're going, or just in general, there's nothing really that's making you, no main triggers, but you notice that your heart is pounding and you are starting to shake, you're starting to sweat. This is something we will associate with a panic disorder, which is another form of anxiety that a lot of people face. And believe it or not, children go through this. And I think we'll talk a little bit about how some of these things develop. We may think like, oh, it's the situation in the moment, you'll be fine, get over it. But unfortunately, our children just can't get over these things, and adults as well. We can't just get over it. And I think as time goes on, Ivy will kind of talk about how to manage or how it even develops and things like that. So those are some of the anxiety disorders that many people face when it comes to that stuff. You want to go ahead and talk about
thank you, Eunice. So when we look at depression, so one thing that I also want to hammer on and hone in on, say, children will have some form of fear. It's normal. And even with depression, there are times when children will have occasional sadness and as a feeling hopeless, feeling helpless. But these are cases where it's prolonged and that's a persistent cases. Say be once in a while, be a say be anxiety and I say be a depression. Because don't say yeah, as parents, sometimes we kind of jump to conclusions, we self-diagnose and Google, we start searching and things. But these are cases are extreme and is prolonged. And the persistent cases or consistent behavior is what we want you to be mindful of. So the child feeling very uninterested, feeling sad all the time, it no longer is something that they experience. Feeling hopeless can be diagnosed as depression. So some examples, just so that you have a better understanding. Again, feeling irritable a lot of time, like irritability. And of course, there are cases of Bofour, for example, so diarrhea. And I say, yeah, when you're cold or ear infection or some type of diarrhea, because what they will feel irritable. And I said they'll feel sad. But those are just temporal situations. But in the absence of these things, and Bofour is feeling sad, irritable, they're not sick, but they're feeling this way. You want to pay attention to that. Again, not wanting to do or enjoy things that they like or have fun with things that they used to do. Showing changes even in their eating patterns. They don't want to eat anymore, or even eating a lot, right? Is something you want to make sure you pay attention to. Showing changes in their sleep pattern, not sleeping at all, or sleeping too much, and still feeling tired, is something to keep an eye on. Or even just showing less energy, changes in their energy. They feel very tired, they feel sluggish, lethargic, or even tense and restless a lot of time. All those things are some type of indicators that sometimes physicians will look at. And having a hard time paying attention, not being able to focus on something. Again, children have short attention span to some extent, but in these cases, it's very, very obvious and is consistent as well. And see, you want to pay attention to this thing. And not feeling worthless, feeling useless, or even feeling guilty. When in the kasa, I say a rehona shenema to the point where they just feel hopeless, useless, guilty. And the older ones, you can be able to assess some of these. The younger ones, it might be a little difficult. Or even showing self-injury and self-destructive behavior, wanting to hurt themselves, especially for that adolescent age. I remember when I was in, years ago when I was in high school, there was a friend of mine who would come to class and I would see just like stuff marks on her hand, and I'll ask her what happened, and I'll say she tried to kill herself. And they would use, what they do is they will use like a blade in hopes to really like get a vein and eventually like just kill themselves. So showing self-injury, and this is for a parent to even come across something like this, very painful. It's scary too. And a lot of times, especially the adolescent age, you won't really notice this. You won't pick on it until you become until you pay more attention to it. So extreme depression can also lead a child to think about suicide or planned suicide, right? Suicide ideation. Eunice could talk a little bit about that. And they have a plan of how they want to end their life. And again, as I mentioned earlier, Yahu said COVID, in this COVID season, this pandemic, we see a rise in suicide for young people. Unfortunately, it's not just the older folks, younger people are committing suicide. And so it's very, very scary. And as I said before, for youth ages 10 to 24, suicide is among the leading causes of death, right? Now, some children may not even talk about their helplessness, hopelessness thoughts, and they may not even appear sad. Okay, they may not seem, so some of these signs, some of them it's very hard to pick on, right? They may not even show some of these signs, but if you so or young person, you would start to feel something and your intuition will kick in, but at least having some idea of some of these symptoms, is a little helpful for you so that you can begin to do your own investigation and seek medical attention with your pediatrics if you need to do that, because you're not a clinician, you're not a psychologist, and so you can't really diagnose, but some things they're like red flags that you want to pay attention to. And depression may also cause a child to make trouble. They go into the principal's office, they're being called in, they're acting up, they're causing trouble, they're unmotivated, they don't want to focus in their work. They don't want to really do much, and they may come off as troublemakers, or they may come off as lazy, and they might be labeled as such, right? But not, there are underlying issues, and we might not know. And of course, Atiatiano would not help the child. Sometimes there are things happening in the surface and they do not know. And we see that a lot of young people will also get into illicit drugs like marijuana. They will start using tobacco, and we see that even middle school kids are getting into tobacco. They're smoking weed, they're smoking electronic cigarettes, and parents are who do not know about electronic cigarette. Electronic cigarettes are a form of tobacco. Your child can be smoking it in your room next door and you will not smell it. It's an electrical object, and it's delivering nicotine into their brain and into their system, and it's giving them like a high. And so they're using this to relieve. So a lot of kids who are depressed, who might be anxious or whatever might be other issues going on, they might get involved in using this. And of course, it doesn't mean that's the whole everybody depressed might do this, but there are cases who said some young people who are going through depression, they might start using drugs, marijuana, they might start smoking these electronic cigarettes. And parents have to be very cognizant about this, because it's one of those very untalked about things. When your young people are using it, you would not know. You would not know. They can be introduced to it. It'd be at school. Now, down for be ever introduced, to this electronic cigarette, and they might be smoking it, and you would not even know about it. And it's a very addictive substance. So those are just some of the things. If I say a little bit on how this is, how can this be treated? Say anxiety needs depression. What are some of the things that, as a clinician, and even in your experience, what are some of the treatments that will be how are they being taken care of? What are clinicians doing to treat people, young people are dealing with anxiety and depression? So we want to talk about that for a bit, and then maybe talk a little bit about managing symptoms.
Sure. Before we even get into the treatment, I just want to piggyback off of a few things you mentioned, going back to self-harm, right? When Ivy had mentioned, a lot of times these kids will engage in self-harm behaviors and for the desire of wanting to kill themselves. But let us also be mindful that these emotions are hard to deal with as a young child. They don't understand it, especially if they're 8, 9 years old. The emotions hurt so bad that they don't want to address it and don't want to, because they don't understand it, they want to figure out different ways to work through that emotion. And because of that, they engage in self-harming behavior. And for a lot of children that I've worked with personally at psychiatric hospitals, I have plenty of experience working with young children. And they tell me that, and this research also shows that cutting themselves allows them to pinpoint the pain instead of having to think about the emotion. So sometimes it doesn't mean that they want to kill themselves, but they want to identify that if I cut myself, I can see that this is what's hurting me and I don't have to deal with the emotional pain that I'm dealing with. Hard to grasp, right? And it's like, whoa, where did that even come from? But unfortunately, when you are in a situation like this is what comes to mind for a lot of people. And a lot of people engage in self-harming. A lot of young people engage in self-harming behaviors for those reasons. And then Ivy also mentioned suicide. Unfortunately, so many people, so many young people have these suicidal ideations. Sometimes they may not have a plan, they may not have the means, but they have the thoughts. And that is the ideation, the thought to just remove themselves from this world because they think life will be a lot better if they're not here. And this is when we have to really, really support our young people and talk to them, have open and honest conversations. And the conversations aren't to tell them not to do that, right? Of course, we don't want them to do that, but we have to get to the underlying reason. Yeah, we can tell them not to do that, but why? And how do we know that 2 weeks from now, they won't have that thought again, right? So it's a lot of work that we have to do as parents when it comes to that conversation. And then Ivy also mentioned marijuana and the vaping, the cigarettes and things like that. Marijuana is a depressant. It allows them to not feel their emotions or not feel what they're going through in that moment. So once you're high, all your problems go away. But guess what? Once you're sober, they come right back and they don't want to feel those problems. So I'm going to continue smoking marijuana so that I can continue not feeling these problems. And then it becomes an ongoing cycle of addiction. So I just wanted to add that to Ivy's point. So treatments, as Ivy said, you're a parent, you're not a clinician, you're not a doctor. Don't put all of the work on yourself. Yes, you care for your child. You created this child, you are a Christian. Most of us are Seventh-day Adventists. We get that, but it is not your responsibility to take on all of the problems that your child is going through and try and solve it. No, that is not. There are people, God has instilled professionals out there to help your child and help you understand your child so that you can get the help that they need. So one of the things that as a pediatric doctor, most children, when they're going to their general appointments, like annual appointments, you are going to get a questionnaire. If you never gotten this before, this is something that should be happening across the nation. You will get a questionnaire asking you maybe different things that you've seen your child do. Is your child meeting their milestones? Are they sad a lot? Are they doing that? There's a bunch of, I had that. I went to the doctor, brought my daughter to the doctor, and they were asking me a bunch of questions. I was like, this is a lot of questions, but
a list of questions.
A long list of questions, right? But they need to ask you these questions. Yeah. They need to ask you these questions so that they can identify if there are issues that your child is going through so that they can provide you with support. So one of the first things you want to make sure that you're doing is if you notice a change, let the pediatrician know this is what's happening. Let's rule out medical, right? For all of my medical professionals there, we always revert to take the child to the doctor. Let's make sure that there's no issues. They didn't hit their head. There's nothing going on medically, so we can rule out medical. Once medical is ruled out, then we present other things to them, right? There's counseling out there. A lot of pediatric doctors work with counselors that can get your psychologists, social workers, mental health professionals that can help your child go through that. Counseling is so important. In the school, there's free programs for the children at school. Advocate for your child. There are definitely treatment out there. So we call something cognitive behavioral therapy. We don't have to go into detail, but a lot of clinicians use this technique to help the children deal with their emotions, identifying their emotions, changing up the thought process from negative to positive, and how to kind of work through those thoughts in an effective way. So those are one of the treatment methods. But one thing I would just make sure that we are all aware is let your doctor know what's going on. Be honest and open with your child. Let them know that there is help out there and there are treatment options for your child. And so those are some of the things that we present, especially when it comes to anxiety and depression for your children.
I believe behavioral therapy is one of those things that could be done for kids who are diagnosed in those cases, right? Behavior therapy, whether with their parents, whether with just individual or combination of both.
Absolutely, yes. So behavioral therapy and cognitive behavioral therapy are forms of treatment. There's also dialectical behavioral therapy. So a lot of children who deal with suicidal ideation and self-harming behaviors, these are treatment methods that they will go through. There's a lot of programs that provide intensive treatment when it comes to that are under cognitive behavior therapy and DBT. And I don't think we have to get too extensive or talk too much about it, but just so that we understand as parents, when we take our children to counselors, yes, they're talking about their problems, but the counselor is also helping them change their mindset a little bit from negative to positive. And that's how and through CBT and DBT methods is what they utilize.
Yeah. And I want to also just say that let's not be afraid of seeking help. Sometimes we hesitate to get therapy because we feel like it's for people imagining, yeah. And I said, we have this stigma against seeking counseling, and I said, seeking therapy. And see, I always say, you're breaking that mindset. If a child, or even if you as a parent, if you need counseling, seek that help. It doesn't make you less of a Christian. It doesn't mean say and you're strong. And I say it doesn't mean that you're doing something wrong. Is you're seeking help. God has placed these people here to help. And I think within our African American community, that's a problem. Within our Ghanaian community, it's a bigger problem. And within our Ghanaian Seventh-day Adventist community, it's even a greater problem, right? So we want to try to break the stigma. If you need to seek help, and don't feel less than or anything like that if you're seeking help, so that you can get the help that you need for yourself, and I said for your child.
Ivy, I wanted to add one main thing that people will probably be nervous about that the doctor will present is medication. Good old medication, right? Everyone will probably be like, oh, no, let me try another option. But if you go to the doctor, and I think we've said this on a lot of other programs, if you go to the doctor and the doctor says, ma'am, you have high blood pressure and we need to work on managing your high blood pressure, I am very sure you will take that medication. And so if there is something like that presented to you, there are many different medications out there. Ask questions. Why does my child need medication? I won't say jump on the medication right away, right? I will say to ask questions, understand what the medication is. The medications that the doctor give, for example, Zoloft or Prozac, these are not medications that are addictive. We will stray away from addictive medications by all means, right? And I don't prescribe medication, so I won't say I will give the medication, but a doctor, a medical psychiatrist or a medical doctor, primary care physician can prescribe this medication for your child. But ask questions. It doesn't mean you have to take the medication right away, but find out how it will be beneficial to your child. Perhaps your child doesn't even need to take it for a long time. It is very short term, maybe for the school year or something like that. If that's going to help them meet their needs, then I would encourage to explore that avenue. But there are other avenues to getting treatment. It doesn't have to be medication, but I want to make sure that we've talked about that medication piece, because a lot of people are scared.
No, that's a very good point that you're saying. I think our natural inclination is to stay away from the medications because we don't want to just bother with it. We worry about the symptoms, but I think if the doctor says this is the best thing for you and you've exhausted all other options, because like you said, many physicians almost go right away to the medication, right? They will do all the other CPT and behavioral therapy and other things, but if in the event they have to do some type of medication, it's good to educate yourself, find out, ask questions. Don't just let the doctor give it to you and then you take it. So or be or not, maybe a family member be, and I say be, or somebody, a loved one or somebody wouldn't more are you comfortable with, and can help you get an understanding of about the medication or even the side effects of the medication. So other types of ways to manage symptoms regarding anxiety and depression, or as in general, young people or people in general, we need to be healthy, eat healthy foods, right? But more so when dealing with young people who are dealing with anxiety and depression, having a healthy eating plan is so imperative. And to make sure that's a part of your plan, centered on fruits and vegetables, the greens, right? You don't want your child to be eating processed foods and junk food near my any health benefit. You want to make sure that they're eating lots of fruits and vegetables, greens, whole grains, legumes, for example, peas, beans, lentils, lean protein sources, and even just nuts and seeds. Just let them have a holistic sort of
diet,
healthy diet so that they're getting different nutrients as well. Also, participating in physical activity, encouraging your child to be active in terms of exercising, maybe and when you're bicycling home, track, walking, running. All of these things are great. Exercise is powerful because it releases some great chemicals that helps with the mood. And so you want to make sure, say, or young person to engage in some type of physical activity as well. Now, depressed, it might take a lot of convincing, but try to make it a family activity. Even have that time, that family time together. A lot of Americans now, or when you look at the data, we're not spending time eating together. And we need to go back to basics, sitting at that dinner table. How is things going? All of these things, open up, all that, just talking to the children. And as mentioned before, having that open-ended question is an opportunity during the mealtime and other times, to open up and to hear what's happening. Getting the recommended sleep is another good thing to help manage symptoms for their age, right? We know that based on their age, you want to make sure that they're meeting the recommended amount of sleep that they need so that they can function very well. Practicing mindfulness and even relaxation techniques are some things that are very important to help the child and keep in mind, as well as a parent, and when I say as a guardian. Okay. And just lastly, before we wrap up, just in terms of prevention of anxiety, it is not known exactly why some children develops anxiety and depression. Many factors may play a role. So there are some things like biology and just Nippon temperaments. Research shows that there might be some correlation with that. But we do know that young people, and I said adolescent or children or youth who experience some type of trauma or stress, oftentimes can go through anxiety and depression. So whether the trauma, no, you're direct or indirect, no, sometimes that's also an indicator. So let's say, for example, Bofano, it will fear mama and papa no, a lot, and I say there's domestic violence in the home. That can affect the child because that's a traumatic situation. And that is indirectly affecting. Maybe our Bofano is not being abused, but psychologically seeing their mother abused and as seeing their father abused is traumatic. And oftentimes we see that there is a link to that stress or that trauma that they're experiencing, and anxiety and depression. And also we see that being maltreated, abuse, for direct abuse can also be an impact. Being bullied, being rejected in school, all of those things can affect a child. So we want to make sure that sabibi koso it will fear, and I say even as school krana, communicated with them. If they're, a lot of schools have a great anti-bullying campaigns right now for the schools, and which is a good thing to help the young people to kind of understand bullying and not bully each other. See, all those things are very important, and it helps to prevent anxiety and depression. As I wrap, I just also want to mention that, as Christians, we will go through difficulties and we will go through challenges. And I love the text in Philippians chapter 4, verse 6. And that's one of my favorite texts. And it says, do not be anxious. Bible says, do not be anxious for anything, but in everything by prayer, by supplication, and with thanksgiving, giving your request, letting your request known unto God. And so regardless of what type of anxiety or what type of situation, depression that you're in, he's able to allow you to overcome. He's able to help your child to overcome that situation. And it doesn't mean that once you're diagnosed with anxiety and depression, it's forever, right, Eunice? Maybe you can tap it. It's not like a lifetime thing, right? Some people can overcome these things when they seek the right help and they seek the right intervention. So I just want to wrap up with that. And I believe, Patrick said, what time maybe I bit to me open floors for any contributions, any additions, maybe or other clinicians on the line that can contribute to this. That would be great. Or any questions that will be Pacho mobile a day about this time. I must say.
Yo, yada enu anoma no mienu nyina ase enu aba Eunice ene enu aba Ivy yada mwase ewo presentation na mwedi enim de aba betru sabre enu nti enema bebre ena enu anumi aboboso amayen ewo adesua yi mu enu nti se ne ye ne da no sabre yebebie kwan no ama ensembisa ene emwa bia yemu bia nso no na yebisa na omo haidie omo aboa ayi ano amaye na afi yemfri hankono na niema ekoya dream bebre no na em say yenya no yenti yes yenya enu aba odi kan ama mpacho ekwan da honum for
okay, Uncle Joe, Ivy any Eunice said I must say maybe then contribution near me who say in Pempi no foreigners na say immigrant no English enye ye kasa ninti no in Pempi de yamano call hospitals ayana ebia and some doctors in Becano ye tiasia but and I'm say bianca yibebusa for help no yenye nafe enamano aboboso ana Africa could do a baby na aye a little bit too late. Into no near person can say Odo Bako Hospital na say bia near providers neck and own tiasia. It's okay to ask for help. So I deal with mentiasia into say bia meet me I'm interpreter now meet me say because Nyame say yeah immigrant no yeah na your money be no I get it diagnosed later on than or more etibro for na say bia bro for ye or makasa no nti say ontiasia it's okay to ask for help so that the providers can find somebody that can translate and help you and get help for your child.
Yeah, thank you so much. That's a very good point, Pa. What kind of when not your stroke cross you bet asked for interpreters. A lot of hospitals, institutions, they do actually have translation, and Tree Chrono is one of those that some of them offer. And to say I wouldn't say Kasani, definitely seek that help they need, because Spanish for more translators, interpreters just like that. And thank you for bringing that point, a very, very important point.
I also wanted to add that it's so nice to see your Ghanaian counterpart or your Ghanaian doctor at a hospital. And in this day and age, no matter what, you'll find a Ghanaian doctor or a Ghanaian nurse in a hospital that you're in. And see, I would advise that if we have pediatricians for our children, let's also explore the kinds of pediatricians that we get our children connected to. If we can get somebody that is maybe African-American or even Ghanaian or African in some way, maybe they can explain things a little bit better than perhaps a Caucasian person. Not saying if you have a Caucasian doctor is bad or a white doctor is bad, but perhaps maybe getting a doctor that looks like you, who can understand maybe some of the things that you're going through as well, I think would be very helpful. So thank you, Sister Ama.
Yo, about Marcy. Yes,
yeah.
Yes, ma'am.
Yeah, me chamo. No, me pacho de ama kind na make a friends that me test na your program. Okay. Also program like this, I almost say me in your my ebia na chino and ye kakra. But program like this, and yet and kolan kwa per se ye maame no mpanyimfo ye papa no mpanyimfo obi wo a wo free adwuma mu ana wakọ pension obetena fi ohun se de se no osiye adwuma no na waba fi no onye adwuma no a situation or turn around all together so bia na obi wo a ye yinadi ena waba betena fi watena fi for so long say enkola na kwa ohun won ba fi so ohun won no ye busa no questions to me say presentation we know is very very delicate ehia panti system aya mamatwi no emra mu na ye maame no mpanyimfo na ye papa mpanyimfo no so monte ase that's
yeah that's this so
okay any others monase Mama Grace in Pacho ekwanda ho
Okay, Uncle Joe, Medasipa, Chia Ivan Eunice, Yaminsha Mobebre. Even said me were jumum to me say presentation and nim hokakra. So I'm not really sure what's covered, but a topic like a damakoma sopa because I feel like in Kwalabebre go through Sanya my way and unfortunately no your society no we like to attribute it to certain things. And I say, majority of the people don't get the help that they need. But it's a huge crisis is going on right now, and it's not okay. And one thing I make is the bullying. I know, Sir Ivy can't towards it, and I heard her, but I just want to say a little bit more. Bullying, yeah, dear, it affected this generation a lot. See, social media is so big right now. There's a lot of things going on in Kuala. We need to take into consideration saying, these are kids, their brains are not fully developed. They don't have the necessary coping skills. Until when they go into things like this, it would quickly lead them into depression, anxiety. And I work for the crisis line right now. And one thing that breaks my heart is when little kids, 10-year-old, 12-year-olds call in because, they want to take pills. They want to end their lives because somebody bullied them. Like a idea, a tia koma. But nyame can say, sometimes, when we talk about bullying, kids bullying, we're thinking of some kind of social media peers. But parents are sometimes the biggest bullies at home. Parents are, we're talking about people that are doing these things now. Some of them, and especially in our society, some parents, like by default, they do some of these things that they're not really sure. Say, maybe they're not really intending to bully the kids, but they are. Your words, and some of the untimi empower oba say kwabontin and face the real world, face the bullies. Be confident when you yourself, you're not doing anything to help that, and I said to build that. And with that confidence, they're not going to be able to stand it. People would pick up on their weakness and intimidate them. And to Mr. Parents, we should be very careful while we're fighting this bully things that's going on. You're making sure that we are not the ones that are the problems when it comes to our kids. Enti Madam Sepan, I mean Sharamo.
Yo, Emma Grace has said.
yo me pacho musa Grace asema sana wako
Okay.
Me parent inti me pese o mama ensembe na ensese me catch me ba ebia said o sika no ebia me ka asem bi but I think ebia me be free say me tease no but mpese o emphasize was say assemble na ebia ensese ye parent na catch enkola no I free say okay but e bullying that's
Yes, me that's a pass so that's our question. Enti ensemne bi be to say ahwe ni Jimmy bi ni kwasia ye can send be a bibia beka bia anto trimu afafo say no what the oti ha na wo Jimmy and I say bia na sometimes parents ni bi betimi aka say hwe ya waya kakraka hwe aduane ana wudi wo de wote ya no jimye nko aduane nko na odi na waya kese na ate ya na say mpa aduane bi ndi na wunya honam na wafon aye ketekete sa. You know, these are typical things like we would say ebia one kasa like ebia wunnim, and I say out of frustration you would say these things, and it's very common among Ghanaians, you know, but then it has an impact on the brain and how the person will feel. Inti foundation of love. Inti ebi awono obana senior Ivy kind right now no parents be distracted. We are some you have goals. So per se we sit down, per se we accomplish your way. Into wunya time kwalano. Maybe you're not eating dinner together. Maybe you're not sitting down and asking say akosia na kwaku and then we did any course saying then I course wa brabum. Into that foundation, although and I say the bond no any ho. Into when they feel like that, now already know there's been a separation. Into when you keep saying those words to them now, and more impact. Into, you know, we should be very careful. You know, spending time with your kids, you can never go wrong. It's needed. And I know, so we get carried away with, you know, life stresses, but even, you know, just 10 minutes at the end of the day, unwind, you know, do something that is memorable, create memories with these kids. And it does have a huge impact when it comes to sad depression and anxiety. And I think that's it.
Yo, Eda Emma Grace ase on a or the aboa addition. Mount say Enya ama wasa baba Nti a kind of farmer.
Oh, okay, that's it. Person what Grace said, no, and I'm person can say as and Ivy and Eunice can say kind of for no, yeah, lifestyle is a little bit funny and different because imagine it's like probably 6, 7, that's 8, 10 no. Now I cry no ye be or depressed, and I say be or they have like anxiety. As my parents because in a war or how they say I will depressed. And then I will like home. Like and then I would die home. Would the say what's up with it? No go school, no business I did. But and no what Emma your man no say they have some sort of mental health even. Now I say kind of shit. I feel no. Ultimately, 12, 13, 14, 15, I feel no more I planning how to take their life because they have been suppressed for a long time. Say, they are not able to express themselves. Okay, come on, guys. Now, what I can take how I say. Me, my papa, me could my banana is in appointment. I say me depressed and no. And so to me, one man cries and I can. I feel me no do baby no. Now they want to end their life because they haven't had a chance to express themselves and I say what they want to say. No, so my taking no on that. That's it.
Yo, Eda Enyaba ama asibim ewo emwa or the aboa dichin. Pamcho say obi foforɔ nso wasembisa na sadwen tre foforɔ bia emre no ewo hɔ ebetimi ebisa. Okay, ntine Eunice the Eunice ebra train so before problem nem say amanom di kan ho bibiba. Mbisa say akora ko school na enema na teacher for kyerɛ no ɔnhyɛ da nte ase ɔno anim sɛ adeɛ no ayɛ kyerɛ no ɔnte ase a cause depression and anxiety bi ebia ɔbɛfie koraa no a ɔnka nkyerɛ parents na ɛhyɛ ne ho sɛ bibi sɛ ɛkɔ as parents no how would you know sɛ ebia akɔkora no anyɛ open no anka ankyerɛ ɔntɛm a how would you know say bibi sa ɛkɔ so wɔ school
Yeah, that's a great question. Again, they're very delicate. And see, I would say that, again, having that open communication with Abofrano, open communication, not closed-ended communication. So, ubusa questions in a certain way, obitini open up a little more. And it said, if it continues, it can lead to depression. It can lead to anxiety in some extent. And even so, Onokwano is not opening up. I need teacher no en kasa. We need to have good relations with our teacher. Na yun de ekoso it was school. I know that we typically have the parent-teacher meetings and so forth, and every parent should be attending those things. Very important. But another way I get some information is from the teacher. But I would say the best way is yamano and kasa. Yemusa or more questions. You have that communication. So when you have any effective communication, nema bebre or ebia ekoswana problem, and that's a school, that's in your homework, on control. They won't. But when you are more kasa, not ubisa more questions and engage with them more, they will open up. Even the shyest child, and I say Bofana on pekasakrano, they will eventually open up. The younger ones, maybe I would be 4, 5, or 4, 5, 6, 7. Yeah, sometimes it's a little harder, but we can engage them in effective communication and we'll be able to get some information. And even say the responses cry or it will help you to hone in on some things that ekoso. And the nurse should be sort of an eye-opener for you to talk to the teacher to see, say, okay, this is what's happening. And I said, this is what's going on. And to get some information. And see, that's what I would say for that.
Yeah, I also wanted to add on, it's not easy for a child to talk about these things, right? Especially if they know they want their parents to be proud of them. Every child wants their parents to be proud of them. And see, if they're going to school and they're having issues at school and they don't want to come home and talk about it, it's going to take a lot of time. And Ivy mentioned it, I think that's the running trend throughout this whole session, is that we have to cultivate healthy relationships with our kids. And if we're now just starting to do so, it's okay. It's never too late. But you can't just say, oh, I'm going to go, today is the day I'm going to go to my child's room and they're going to tell me everything. Unfortunately, it doesn't work that way. They have to trust you as an individual, as their parent before. And it may take time. It may take months to a year to 2 years before you can get the answers that you need from your child. But you have to be consistent, right? And so I think that sometimes when we don't see what we want or we don't get the best results from our child, we want to give up, right? And we want to get upset and frustrated. But our children are so delicate. And we also have to remember we were children too, right? We also went through some of the things that our children are going through. And so being able to cultivate those healthy relationships are highly imperative. And start today.
And I wanted to just add a little bit of what kind of dynamic idea. I'm dear Grace, sometimes when you're trying to get information from a child, open up. Your natural feeling is to be upset. And sometimes you might use words that are positive. We have to be very careful with those. Before we want to be mindful of how we're engaging with them when we're upset. We want to empower our children. We want to be able to use positive words of affirmation. Self-confidence, self-esteem, and who they are as an individual, giving them that confidence, that they are smart, that they can do all things through Christ who strengthened them. Given these positive affirmations, even at a younger age, rather than using negative words in the event, they're not producing, and I said, grades is not very good. Maybe not other things. So to you adding negative comments and negative words, so Emma Abofrano goes through some type of fear, and it shuts them down and it shuts them in, and Emma yet less likely to share with you the Koso.
Okay. Yo, the master. If I'm sure Obifour so as Mbisa Nasa adventure bia a twine at the honum, I bet me at the upper. See, why I transit Obi, okay. Mama Vivian Pacho Equine Homa.
Kakana was with the boy, and saying a ham of friendly pie. The last 2 weeks or so, you treating the Kakana, may Yakwam fat say, say, or move to sue like your mobile was school. Now, yeah, I say, or move prefer science, like subjects now, they end up in the science field near the, I don't know. It's causing a lot of kids stress. Nkolani bi wɔ hɔ nsɛ nkolaa no umayɛfo anaatre a ɔmo nyinaa hoɔden nyɛ pɛ. Ɛnyɛ dan a baako bi bɛwɔ mu a asɛ ɔno ɔyɛ yi kakra. Maybe with encouragement ne ade you could bring them up. But the mehu ne sɛ asɛ parents no yɛforce wɔn to be what they can be. Tutumi hu sɛ akwadaa no struggle ɛwɔ kwan mu. 21 na aye depression, anxiety, symptoms. You say ya na ya le no wo dada na ya ekoba na say with load no mo coffin. But what I'm seeing is that so many science students. This is what I'm seeing. Won't call along the line no say subject na almost out. Do na they end up being depressed. In the pay particular attention, which means the chrome has a when you dear Casacriana or move a vocational school, betting me and son where you say as long as they take it far, no, a betting me I there like, betting me I they are sustained even in the bush, but do not know a person, be a person by a net, be a person by a doctor, be a person engineering. I said, the young to me, I'm going organ and only a person. Your money, you, I don't know. But in Colorado, more. Yeah, if they take it at the highest level, they are also making it. If you pay particular attention, in our strength and hear the same. Now, most of depression, we, the parents, we are causing it. And at last, we can say that depression, also, and can you follow so a view or bipolar near the deal? Yeah, come on, Colano. Yeah, champagne for no. You know, partner to one and you may be in Korea. What's seeking help? What's a Ghana young diagnosis and termination? You need San Yamano or near the Empire, Bonia, or near the Ina from Lipanoya, Leanoya, Luna behavior being Korea, and Tampana no seeking help. I can't go Colano, so through that, Nukranu be a family line. Na well abuama nkwala na bi o mo so say be a true inheritance what me solve that problem to me that was it.
Yo, yeah, Mammy Vivian, so I say, oh, no, so no more the other boy.
Grace, added a quick comment.
Okay.
Yeah, make if that's okay.
Yes, I be kind of.
Okay, may that's it. I just wanted to add to the first comment, and Adele Kayana is so true. Yana parents are all funny. There's a lot of pressure in my frano because we have a certain expectation and that's a certain career path. You who say what's that or and we always thinking about the sciences to say the examples I would in mind, but I was that and a lot of, like you said, a lot of young people are depressed because of these issues at echo school. I was so ubana strength in the area. Okay, sometimes no more will have they're very talented and they're creative. Omutimi draw nema, not oma design it. You know, in this country, designers, they're making money. Omu pam nema, omu a fashion designer, omu to draw things. No ma so no ma pam. This is one of the areas Ayana Sabiyana say a monocra it go into because we think that it will not generate money. But sabofano interest will na nyame adom nipa no it's me meki or nya education in order to couple with that, they will be very successful. You hear Komo has said these fashion designers known as these into those they're making a lot of money. And see, it's true. So man limity a man to only being in the healthcare fields, right? I'm a healthcare worker, but if my child doesn't want to be in the healthcare field, maybe I'll interested in something we want to be able to encourage them. Of course, education is a must, right? We want to make sure, because no matter what, education is going to be the foundation. But say certain area, you encourage you more in the area that we see that they're very good at, and also and also no, although this is a topic for young people, no, maybe next time we have to do something about and paying for it, because this is also a very big problem. Affect our worry for bipolar, schizophrenia, and couples are and and sometimes there's a lot of mental health things going on. And hopefully we can have that discussion another time. They are educating about some of these things and seek help. Say you be or somebody and I say or exhibited certain mental health issues are. Let's not hide it underneath the table. You can want some night and get it treated and seek help. That's it.
Yo, yada in your IVC. Margaret Zimpacho on sa Australia na first na.
I been so.
Okay.
Na the things that Ivy address kakraba meka kitwe aka with near anti-Vivian kind. Sa issue no yeah asama issue air kosupana. I just want us to say something real quick. Usually in the Yaya society, we like to confuse intelligence with a bia obi profession bia woye. But basically, intelligence is just how you apply your knowledge. So we when in DB and how you apply it. And no fact would degree bia winya. But I think senior munyina makano. And it has to do with where we're coming from, and say you share the baby are free any point you fast with it like being in the medical field can be something that's very respectable, and most of the time we would say be a doctor, and I say or be a doctor, lawyer, nurse, be a or nyansapa or nimadie. But and then problem here, most of the parents, will force their kids to do something. Auntie Vivian can say, it be not own to me. But the point is that we can be anything that we want. But the point is that you would only accomplish when you operate in your strength. And to be a nursing. But the fact so nursing doesn't mean say and no nakuma when you go, you say you never kind of cry. When you go to the hospital, you see different doctors or nurses. When you see obia a passion, I will apply a be an education to the passion no one the services can I say or no crampo the way I obey see the empathy, everything coming together and no crowd promote healing. But then you see people that are just there because maybe the family wanted them to do that, and I say be or doing say sikebia obenya binti ena or koye. But say you back kind of cry when you look at a reaction has say a month for or making it big. You will not see a nurse who is a millionaire. There are no nurses that are or but there are people that are using their skills. They are barbers, or be a barber or a millionaire, because they took that passion, they applied the knowledge and guidance. And because of that, they're making a living. You will never get there. There are people right now using social media accounts. Knowledge be apply to certain things or be to computer, so Instagram to see or show the family or a millionaire. A be an we are quite juma koponche per time of a crampa unya. So we should and I would say that especially as Christians, I think that God has a purpose for each of us. Now we ding and kupon God will bless you immeasurably. And to parents, mumaye, because I had in for bebre, and let's your friend is saying that vocabulary, and I said when I used to say be a own to me. No, on to me said, I believe you can do anything that you want if you get the support. But is that really what you want? At the end of the day, if it's not your passion, if you don't love it, you will not excel. Until let's see that obia ni strength, obia ni interest. Until when you as a parent and you recognize that, not what guide a prano to that. Senior Ivy kind of their fashion designers are they're making it big. People, all these people, no omunye obia just say oko obia jumamu ekoye jumabere, you know. We should allow our kids to explore with them. Now allow yourself to be the guide. Abra, you know, you're in pieball can so they will succeed that way. And yes, depression and anxiety will never leave us when we try to be things that we're not. And yet said we can be, but that's not who we are. Yeah. That's it.
Yo, Emami Grace Ase. Pamcho, Bradan, Pacho Equanda
Pacho, you me that's it. I'm say points no be great. Who say my point out to the marker. I can't miss a can say as we continue to figure out for talking to Nkulana about their skill sets and what they're passionate about. I think the conversation this also has to be about how they're going to be able to function as adults, finances. Say I'm a passion, you say, and I'm a passion, you say, and I'm interested in this. It's no problem. However, I think say in previous conversations we had, you need to figure out, okay, if that's your passion, if you're going to do that, how are you going to sustain as an adult and to be able to function in all categories? Because so when you're not to me, figure that mathematics in the outer. Sometimes, bet me about say a club or be a penny say, but they be at the oko so to me money and function as an adult. I think you said all the categories now I'm mentioning, are very important. Say or more explore, no more share your brave, because in fact there are so many different degrees that accumulates a whole lot of what I've heard over and over, wealth. However, it's also imperative to talk to them about say, okay, it be up so couldn't say so unya way what can I say catch on so okay, meet me the way, and I could live on my own, not necessarily say, oh, I'm a passion here, but they don't really have the direction to that passion.
Yo, yada Bradan so ase no so ne moa or the ababeboa. Okay, Tim said, Yamre no akodanim and unti yebe de na disuane ba na wie ya no. Nti sasem bisa bia na asadwen chefufro bia eni hobie mu dia yebe ma yenu aba bi ni Eunice amayen last messages na yahwe na yede and addition na si yasha say de yame adma yebe san aba beto asoba before say Davia na Eunice mbaba no pacho sister Fia e pacho ekwan da ho.
Oh, where there, Madam Asipa, Bejafo, ni adofo amola isina. Many aje. Me who said na linky da obi Zoom adia suna me say my memorial is na meeting.
Okay.
Na many aje the watching in rain. Yes, sisters, no more dika kasani.
Okay.
The anxiety and depression once more can very true. Yeah, okay, Ghana for ya fitna mua. Nima ya formu fi nti ebi amoaye. But ya ba ya no so mo fra ya be wo mo ha no yentimi nya sa time e ma wo. Enti ato da bi a ade bi a ne ya dwen ya ese nkura no manya ne easy. But say yin say ya be wo nyina ya bom pa ya ese ya ma no mutimi enyame ma omu ntimi enya amaye. School, not so much enkoya awofo no nyanya abotre wo Proper said yes, they crying your direction how to stay. And see, I will follow her say, and yeah, break you see, one. I didn't so I shall say, now put your Pennsylvania, and I had it is annually in a someone, crown teacher for the complaints, Banya, they now crana is so anxious now, a toda crana, this young moon person because school near day. And see, that's the sisters, Eddie can't train, and I mean, say, yes, yes, and be a free. Yamisha Munina, amen.
Amen. Yo, it's the fear that was surpassed and also to me joining here na ode wadwen chiraba bebo na otwibia ya wada bia ifri no nso ebesi no otwe ne fam ha no ye yes addition nti aya na wa tai aba na wa ba bebo aye nso. Yo, ntene Eunice say more last final messages mo betimi e de amaye na afi de ne esi ha me yo gidie se nyame adom a ye be sign abeto adesua so nti mo my last message.
And a prayer, brother Patrick, it was for Musie and Nemo joining us at Damwasipane. We learned a lot. The contributions more provided. We talked about anxiety and depression or framu adolescent age specifically. It's ways that you bit me identify symptoms and signs of anxiety and depression and the sort of takeaway message today is really let us identify some of these things, exactly when to seek help. Say yeah baby and I say yeah nana be or obia yenimno is exhibiting some of these seeking help and get the help that they need so that they can better function in their daily activities. We serve a God who's able to do everything, regardless of what the doctors say. God is able to turn situations around and see, as believers, that positive mindset, that hope that as we're seeking help, we're also doing our part and working closely with our child, communicating with them and being able to build that relationship so that Bibi Kosoa will be able to provide the help that we need for them. And see, Mecca, so Eunice, so any other closing remarks, that will be to me. Okay, that's it.
Yes, I think you said it all. This is a topic we will have to talk about it forever, literally, because the way at Nemasiko it's very tough. So I pray that whatever was discussed, we will continue to have these conversations at our churches, in our homes, workplaces, because our children need us and we need them. And so I really hope that we were all able to gain some knowledge and take it into our homes. Yo,
yeah, that Eunice Bra more dias and Yanom be brain so that one's massy our platform is so Mr. Grace said or the mummy nuna say or near my sister Pia and so Edda Massessa in your Bema back when so no dear no ever iPhone. So Edda Massinti, Yenina, so Edda Massessa, Yame assign at the mobile na mobile be any award this year. You GDA set Yame Adoma, your best sign Abbott to us so setting up more year, then ya any pen be break cano. Ya shall see or more frame, you GDA set. The ramping phone dear and Yame Hokrabe a yassing and more frad ye can't was because I'm penning for honor and some more. And some more hopper NT. Now may add more me sure so for by you bet twice on I didn't come on the say you bet me the penny for the ass and bet twice na yeah baby and so the BB by and so yeah dear home befa. Onyame enhira mu nyina and then so nipa do I timi by nyina no ni gyina osofo anan mu na masa da mu nyina asese ene mobile sani sister Pia kan ye share obi nso behu no nso enya kwan abetie bi ewia adesua ya ye ni nyina no ewo YouTube channel okọ ho no mo a enrich your family series o search ya ubetimi enya no atie ni nyina, but the best you ni subscribe ya extra subscribe into ya sha say ya no unsa betimi aka notification no na wa join ni ana wa hwe no YouTube na watie asua de se ne aye no na otwe bia no eno nti onyame nka ye nyina ye ho na omo ayen ebra ye sua entimi mfa nya adwuma na mo aye ne ye ma ne ye namfonom ne asafo ma nyina nyame nka ye nyina ye eno nti yade sua no eba awie ye se obi aka bibi wa okay in terms obi nso ede na de ne moa no eba akire ya yenua Andrew so se yensem a ye ka ene empo ekwan a ye fa so ka yensem no aya na etimi eha ye ma no eno nti ye kasa ya ye nhwe no yie ne sen ensem no se ne beba ne the sound and as a tonation I de ka yensem ne bebre no mama ye nhwe ni nyina yie na aboa ma yetimi ne ye ma no atena se tien openi Andrew unso yada wase se ode sa adisua na se asemu ya ba bebo ama yewie yade sua no esi ehanom se ne ye no ye bebo mpaye na afa yewie a yade esi nti oma emompaye eja kronkron enenso biem oma ye san kasa sedan kan odi se ode yenua ba Ivy ene Eunice ebreye na onam omo so aba be kire adesua etisen yesel se ne omode ama yen boyen na yentimi ntiase ne yentimi fansiesie homo ye breye yesel se obi bia otie sa adesua bibia kane ho so sa ha bia na ne ma na na busua ni bia obia yesel se boyen na yentimi emmoa wo mo no mo so ntimi ntwe mo ho mfrim abo asiesie nyina ma wo try because see be san be share mu bio na otwe said ne what amen yo and
Amen.
ya men kan ye nyina ya na otwe said ne osan de yen kwache ya ye be san abeto aso ye da mwase
Patrick,
yo okay yo mama bye